Hello and welcome. I'm Dennis Lyons, the editor of the Daily Item, and I am glad to have with us today Dr. Jennifer Rager-Kay, the Democratic candidate for the 85th District State Legislature seat for the special election that will be happening on August 20th. We will be interviewing both candidates for office and posting video of those interviews on our website. Welcome, Dr. Jennifer Rager-Kay.
Thank you. Thank you very much for having me.
We talked before about what we will call you because Dr. Jennifer Rager-Kay is a little bit of a mouthful.
It
so
is.
We're just going to go with Dr. Jen.
Absolutely.
Okay? All right. So let's start with an issue that comes up. Anybody who runs for the state legislature these days gets asked a question about the minimum wage. Now, I know you've expressed previously that you are in support of raising the minimum wage. Can you please tell us first why, and second, how you'd like to see it done incrementally, tied to the cost of living index? Talk about that.
Yeah, absolutely. That's something that I think deserves clarification. It's one thing just to say, yes, I'm in support of minimum wage. It's another thing to say exactly how. The issue with raising minimum wage that's somewhat misunderstood is the issue of small businesses suffering, losing employees, having to raise the cost of certain items that are being sold. The issue that we need to look at as a broader picture is the fact that when it comes down to who is buying these goods, who are the ones that are spending the money in the community, it's those in the middle class. It's those that have minimum wage paying jobs. When you put more money in the hands of those voters, those citizens, they're going to spend more. It's the opportunity to buy the daily necessities. And whenever they make more, they'll spend more, and it's an economic boost all around. The issue, however, comes down to the concern for doing it all of a sudden. And that I don't agree with. I certainly think it needs to be done very slowly, incrementally, and there needs to be legislation in place to safeguard some of the small businesses so they're able to make these adjustments as necessary. I think it benefits small businesses to raise the minimum wage. When you look across the board, not only it improves employee satisfaction, decreases turnover, more happy employees stay longer, work better, and they actually tend to spend the money back at the places that they're employed. So it's a bit of a win-win situation.
And do you think it should be tied to the cost of living index moving forward once you've
I
started
do.
the process?
I do, and certainly, you can't expect the economy to continue to prosper if the cost of living exceeds what we're making. And, that's part of economic development that I think the state of Pennsylvania is very far behind in, and one of the reasons why communities like ours haven't really prospered. You look at other states that have raised the minimum wage, and it's been very successful for small communities and small businesses.
Okay, thank you. Fred?
The statute of limitations regarding sexual abuse in Pennsylvania it's been an ongoing battle, and one that will certainly come up again this session. What are your thoughts on removing the barriers to offer closure and compensation to sex abuse victims?
That's definitely a tough question when it comes to both sides of the issue there. I certainly, I'm for the victim in all aspects of the case. However, I do know that there are flaws in our legal system, in our judicial system, and we need to safeguard against those as well. My husband is a public defender. He's the chief public defender for Snyder County, so I see a lot of the turmoil that goes on when it comes to victims, the defendants, prosecution. It's definitely complicated. It's more complicated than just saying, yes, I think we should lift the restriction, or no, I think we should keep the statute of limitations in place. I think that proper legislation can be made to kind of protect both the accuser, but also those that have been accused. So, I'm all for the side of the victim. I certainly think that all too often, women and men both are afraid to come forward immediately when something happens, and we shouldn't punish them just because that fear is there. So there certainly needs to be a lot of discussion when it comes to that, and I certainly think that's something that hasn't happened yet, so I would not be willing to make an immediate determination for that.
Well, actually, the House has already voted twice on legislation that would do that. It's just not ever come through the Senate.
Correct.
So it's not like there hasn't been a vote on it.
No,
already.
But nothing has
And
passed.
in fact, the person for whose seat you're running voted for it.
Absolutely.
And a lot of people did. I think it was pretty much a bipartisan vote.
Yeah, absolutely. Absolutely. But again, I think, the fact that it hasn't made it through the Senate brings up that there are some concerns when it comes to some of the fine details with the limitation.
Okay, Bill?
Just to follow up on that, you said proper legislation can be made. Is it sort of similar to what we see in the House now, or is there sort of some kinks that have to be worked out? I mean, would you support the bill that's already that's passed through the House?
I would support the bill. I think that there are some issues with not having a limitation at all. That has to be looked at and can be corrected rather than just scrapping the whole bill itself. I would support it, but I do think that some amendments could be made.
Okay. We're coming off 3 mass shootings in less than a week. The president's in El Paso and Dayton today. Governor Wolf wants to close some loopholes over the private sale of weapons. Right now, people can still buy assault rifles, in private sales. Some red flag laws have passed, but some red flag laws still remain, including taking weapons from someone who's dangerous. What sort of gun reform do you support?
A very important question. I think that we've kind of reached our limit, and something that came out recently was that other countries are issuing travel concerns for people coming to the United States, and that's heartbreaking. And so I certainly think that there is room for gun law reform. I don't think that we should say ban everything, take them all away. I'm a gun owner myself. I have a concealed carry permit and I exercise that. But I also think that reform needs to be placed so that there's protections against placing guns in the wrong hands. And when I say that, you brought up an issue about people that are not safe or unsafe, convicted criminals, sex violence, domestic violence. Those are issues where things need to be reformed and looked at so that they don't end up in the wrong hands. Yes, it's important to define assault rifle versus a shotgun or single fire or automatic, semi-automatic. Those are all kind of semantics, but when it comes down to it, the 2 biggest issues are making sure that the guns don't get into improper hands. One of the things that kind of ties along that is not only the hands of criminals that could use that, but also patients who suffer from mental health and addiction. That's a big area that it's the first area to get funding cut. Whenever there's funding cut from budgets in order to pass a budget, a lot of times it gets cut from the mental health services. And it's certainly not going to make us any safer if a patient who is not mentally stable can get their hands on a gun. The other issue with the state of Pennsylvania is there's really no regulation in place. If I go to an auction, for example, I can buy a gun. That person doesn't have to ask me who I am, any charges ever brought against me, what my mental health is, and that certainly I think is flawed. If I want a gun, I should be able to go and purchase it at a dealer, be willing to wait the background check, and if it's something that I can't wait for, well, then that's my fault. I waited till the last minute. Certainly waiting 48, 72 hours to have that proper check, that proper coverage is certainly something that I don't think is an issue. The other issue that I think that we're seeing, it's one thing to say gun reform, get rid of assault weapons, make sure there's background checks, but something that is going on right now in our society is one of the biggest reasons I'm running, and that's the evilness, the polarization, the hatred. We are such a divided country right now. And the fact that, I think we need a president to be able to stand up in front of everyone and condemn this and say, this is not who we are. This is not what I stand for. It's the gentleman that committed the most recent shooting in Dayton, Ohio, sane individual by most parts, what we all think, filled with tremendous hate, obtained a gun legally, and it was a handgun. It's all of these things. We look at all these ways to potentially safeguard. But if we don't have a representative, a president in the position to stand up and say, this is not okay. This is not something that I stand for. And is it going to stop every shooting? No. But I certainly think it's not a black and white issue either.
The district you represent is the western portion of it's very rural.
Absolutely.
A lot of gun owners out there. What do you hear from constituents in the western part of your district about this?
Yeah, I think that there's a big misconception too when it comes to the Democratic Party, which is, excuse me, another reason, another reason why, putting people first is my slogan, because I don't care what the Democrats stand for. I don't care what the Republicans stand for when it comes to doing what's best for the constituents. And they unfortunately see the Democratic Party as someone who's just trying to take all their guns away. And I'm trying to break that stigma by saying I certainly hope that's not the case, because I don't want anybody taking my gun away. And the fact is, hunting is something that I grew up with. My father was an avid hunter. You should be able to have that enjoyment, have that ability, but we could do it safely.
Dave?
Dr. Jen, thanks for joining us today.
Thank you.
Broadband Internet is critical in all aspects of life today. The governor has proposed taxing natural gas drilling to pay for broadband access. Do you support this measure, and how can Pennsylvania fund this infrastructure upgrade?
Good, absolutely. I definitely do support that for lots of reasons. First of all, we cannot expect our economy to prosper and develop in our district if we don't have measures in place for small businesses and even larger businesses to come to this area. If we don't have high-speed broadband internet, there's no way a company is going to come to our area and expect to be able to advertise and run a company without that. We need to find out a way to pay for it. Ways to pay for that would be finding ways to have recurring increases in revenue, not just a one-time deal. And I certainly have proposed this before, but I absolutely support a shale tax. The thing that, again, I think it's a big misconception that people are being told if we have a shale tax, it's going to get passed down to the consumers and everybody's going to suffer. The fact is, over 85% of the natural gas that is received from the state of Pennsylvania is shipped out to other states. If you look at your gas bill, you pay a severance tax to New Jersey, to New York, any of the surrounding states. Why it leaves, I have no idea. But certainly if a company is going to come take our resources and ship them elsewhere, I think they need to pay for it. Impact fee, phenomenal idea. It did well, but it's on a descending level and it has a limit number of years that we can charge. Industries are showing that with increases in technology, those wells are lasting longer. And so basically once that impact fee runs out, they're drilling for free. And again, we're paying shale tax to other states for that. One other misconception about the shale tax is that the companies are going to move. If we increase a tax for them, they'll leave the state. The fact is twofold. One is Pennsylvania is the highest producing natural gas state in the country. And number two is the governor's proposal for the shale tax is actually still less than the tax that's paid in Ohio, New York, and New Jersey. So there's really not a lot of threat for companies to leave. It's a phenomenal source of millions of dollars every year that we can receive funding from, and it's a win-win situation.
Okay, yeah. Medical marijuana. First of all, as a medical professional, were you in favor of that?
I am. Pennsylvania has already passed, the use of medical marijuana, and I certainly think that it has phenomenal benefits when it's regulated. And go ahead.
So, do you think the way it's unfolding is working? It feels like we don't even have a dispensary in our area.
It's coming.
Yet. And my concern is that right now it's not even possible to decide whether it's successful or not, because it's really taken a long time. So how do you feel about the way it's been rolled out?
It has been a very slow process, but I also think that there's means behind the madness, and that has to do with regulation. If we certainly just say, sure, we're going to legalize marijuana use, I think that's reckless. So to have the ability to mandate and regulate that is important. There is going to be a dispensary opening up over across the river in Snyder County, and that's something that I think is going to be good for the people of this area and my patients as well as several other physicians' patients. One thing I think we have to keep in mind too is there's benefit, but there's also room for abuse, just like any other treatment mechanism. The one thing that, again, is a bit of a misconception is that marijuana is going to be something that everybody's going to be walking around in this, stoned state of being high from marijuana, and that's not the case. Medical marijuana is so highly regulated and so detailed when it comes to what actual part of the plant is being used for the treatment that there's safeguards in place. And I think that's why it's taking so long for it to be able to come into our area, as it should.
Are you someone who's set up to prescribe it?
No, I'm not.
Do you intend to become one?
I do not.
Okay.
It's treating chronic pain is not in my specialty as an ear, nose, and throat surgeon. I treat acute pain after surgery, but I certainly think that a lot of the primary care physicians in the area are looking into that, if not having registered already. I do know a select few that have.
Okay. So then the next obvious question is, do you support the legalization of recreational marijuana in Pennsylvania?
Yeah, that slippery slope, certainly, when you look at it from a physician standpoint, a medical standpoint, there's phenomenal benefits from that as well. Looking in this area, unfortunately, with the opioid crisis and epidemic of heroin overdoses continuing to rise in this area, it's something that I think needs to be paid attention to. It's one thing to go to a physician and have a diagnosis to be able to receive medical marijuana, but patients who are suffering from an addiction, chronic pain, we have a physician drug monitoring program in the state of Pennsylvania, which has greatly, tremendously decreased the number of narcotics that are out there in the hands of patients. However, there's nothing in place to protect those patients when they get cut off. So basically, somebody's been on pain medicine for 20 years, and now we have stipulations in place. Their physicians are saying, sorry, can't supply you anymore. So they're going to go to an illegal process of doing that. And the sad part is heroin is the cheapest alternative. And that's why we're seeing, even though we're seeing decreases in the number of prescription narcotics, we're seeing an increase in the number of heroin overdoses. And I certainly think that there's alternatives to look at that. But obvious safeguards are one thing. Revenue is a whole other issue when we talk about looking at other states like Colorado, for example. They received so much in revenue from sales of recreational marijuana, the taxpayers received a check back. So that's something that, again, slippery slope, certainly can have tremendous pros and cons, but I think it deserves to be looked at.
Okay, so since you kind of took us to the drug problem, let's go there a little further. Do you feel the state government is doing what it needs to be doing, and if not, what else can they do?
I don't think that there are necessary programs in place to help with the opioid epidemic and the addiction problem that's going on in our district, let alone in our state. And again, one of the biggest downfalls is mental health and addiction services are usually the first that have cuts when it comes to the budget. And you can't expect to treat a problem when you continually to take money away from the services that can provide help. Unfortunately, it's easier for patients to go on the street to get what they need rather than going to a physician. One thing that I think that needs to be looked at is alternative sources for treating these patients, and medical marijuana being one of them. Tremendous opportunity for us to treat patients in a very safe manner with little complications from using medical marijuana to detox a patient or get them off of their narcotic of choice. And without having an open mind to look at these alternatives, the solution is never going to happen.
Okay, Rick?
Okay, Dr. Chen, let's jump to another subject, the size of the legislature, which, as you know, is among the highest paid in the nation.
Number 2, actually.
Yeah, so there's talk of reducing it from 253 to 151. What do you think about that?
I think, again, it's something that deserves to be looked at. The only reservation that I have, and that I've mentioned before, is that whenever you decrease the size of representation, for those in rural areas like ours, you run the risk of losing the rural representation. And I think that's something right now that we even have going on within our legislature. Philadelphia and Pittsburgh, and then everybody talks about the T in the middle. And, we're not really paid attention to. We're the last to get help when we need it. Everybody focuses on these larger cities that we have. Potential risk for if you decrease representation you're going to decrease the representation of your constituents as well. However, I do have an issue with the fact that our legislature is the number 2 highest paid in the country. And I take kind of offense when people bring up the idea of she's just doing it for the money, she's a physician, what does she need to do that for? I can promise you that if I were to be elected, that's a pay cut that I would incur. But I also think that you have to look at the definition again of full-time legislature. And for example, in 2018, there were 47 days that the legislation met in Harrisburg. Representatives are extremely busy, and so are senators. I know they have committee meetings, they have obligations outside of Harrisburg within their local offices. But if you could make $86,000 a year by going into the office 47 days a year, that's a pretty nice deal. And I certainly think it's something that we have to take into consideration because it's the taxpayers that meet the burden. So being able to reduce the size of the legislature down so that we still have safe representation, but we're saving taxpayer money, I certainly think is something that we need to look at.
Sort of piggyback off you going and taking a pay cut to go down to Harrisburg. Why go for this office then? I mean, you there would be the pay cut.
Yep.
Obviously, you've run for Selinsgrove School Board, and I think you have a seat on that secured.
Absolutely.
You know, and that's a way to represent locally. So why go after this one?
For me, it has to do with my son and my son's generation. And for me, and I've mentioned it before, there's only so many rallies you can go to, only so many phone calls you can pick up and make to representatives and congressmen and women. For me to be able to say that I'm doing something for my district is important to me. My husband and I are vested in the community. We don't want to go anywhere. But I want to make sure that our area is sustainable so that not only my son, but other members of his generation stay in this area. You know, I go back home to Western Pennsylvania where I grew up. It's extremely sad. You know, I'm a coal miner's daughter. Either you work for the coal mine or the steel mill. And when they start closing, it's a ghost town. You know, I drive through my old neighborhood and abandoned houses, and it's heartbreaking to know that there's no way that area is sustainable at the present. I don't want the 85th district to turn out like that. And for me, I'm willing to make that sacrifice not only for my son, but for other members of our community and our district. And I don't pretend it's going to be easy. And I think that every time someone brings up the issue about how's she going to be full-time, part-time, I'm not really special when it comes to that. Over half of the members of our legislature have jobs outside of Harrisburg. So I'm not unique. For this area, maybe, because our representative for the last several years has not had employment outside. But I think that's what also helps you keep your eye on the prize when you're in Harrisburg. You're not there just for the paycheck. You're not there for the fame and the representation. You're there to prosper and do what's best for the people of your district. And being able to keep focus on that rather than worrying about who's putting money in your pockets and trying to bribe you as far as lobbyists go, that's something that I don't have to worry about.
So neither one of the candidates in this race have held elected office before.
Correct.
And that's sort of an unusual circumstance when we do these interviews. It's usually an incumbent versus a challenger.
Right.
So talk to me about how your experience as a doctor prepares you to be the person that the voters should pick, and other experiences beyond being a doctor have done that.
Yeah, a very unique situation, and I think that's one thing that I even look forward to the most coming into this. And we have to remember that Congressman Keller sat in this position once and had no experience as an elected official either when he came into this, and according to the majority of our district, did fairly well. And as a physician, I hold a unique position of being a bit of a public servant. My job is serving others, taking care of others. It's not an elected position that I ran for and had to be, get the proper number of votes. But I certainly think that having patients come back time and time again is similar to having a vote from somebody. And when it comes to my position as a physician, not only am I taking care of a lot of our constituents in the district already, but I have the ability to do it unbiasedly. It's not a matter of I'm only going to take care of Republicans. I'm only going to take care of Democrats. If you have Blue Cross Blue Shield, I can't take care of you. I work for a hospital system. I don't have to worry about an insurance program. I don't have to worry about what religion you are, where you came from, what do you practice, what's your sexual orientation. I take care of patients regardless, and I'll do the same in Harrisburg.
Okay, I appreciate the time that you spent with us this afternoon, and we wish you all the best between now and August 20th.
Thank you.
Thank you very much.